Before we dive in, a quick but important note. The information in this video is for educational and informational purposes only and does not constitute professional career, financial, or academic advice. Always consult with a qualified professional or academic advisor for guidance tailored to your specific situation. You're standing at a crossroads. You know you want to help people. You're fascinated by the human body, by the science of wellness, by the intricate systems that keep us alive. But the thought of a decade of med school, the soul-crushing debt, and the MCAT gives you a panic attack. Or maybe you're drawn to nursing, but the intense hands-on clinical demands feel like they might not be the right fit for your personality. You look at physical therapy, at being a physician assistant, and you see amazing careers but also hyper-competitive narrow paths that require you to be 100% certain right now at age 19. And you're not. You just know you belong somewhere in the world of health. You think to yourself, there has to be another way, a path that's flexible, impactful, and doesn't lock me into one single job for the rest of my life. If that sounds like you, then you've landed in exactly the right place. Because today we are pulling back the curtain on what might be the single most misunderstood, underrated, and powerful degree in the entire American university system, the health science major. This video is your definitive guide. We are going to break down exactly what this degree is, what it absolutely is not, and demystify the incredible range of high-paying, high-impact careers it unlocks right here in the United States. By the end of this presentation, you will have a crystal-clear roadmap. You will know with confidence if a health science major is your golden ticket to a fulfilling future, or a costly detour you need to avoid. We will cover the specific jobs, the real-world salaries you can expect, and the secret weapon skills you'll gain that make you invaluable in today's job market. So let's get right into it. What on earth is a health science major? The problem is that the name itself is frustratingly vague. Science for health. It sounds like a backup plan, a major for people who couldn't get into nursing school or washed out of pre-med. Let's shatter that myth right now. That is completely fundamentally wrong. Think of it like this: a biology or chemistry major studies the pure science, the molecules, the cells, the raw biological processes in a lab. A nursing or medical student studies how to diagnose and treat disease in an individual patient. A health science major studies the bigger picture. It's the bridge between the hard science of the laboratory and the real, messy, complex world of human health. It asks different questions. Not just, how does this virus work? But, how do we stop this virus from spreading through a community? Not just, how do we treat this patient's diabetes? But, how do we design a citywide program to prevent diabetes in the first place? It's the study of healthcare systems, public health policies, patient advocacy, data analysis, and the social and ethical factors that determine who gets sick and who stays well. It is, in essence, the science of keeping people and populations healthy. Now, here is the most crucial thing you need to understand, the part that most college websites fail to explain clearly. Most health science programs in the US are split into two distinct tracks, two very different paths you can take with the same degree. Getting this right is the key to everything. First, you have the clinical or pre-professional track. This path is specifically designed for students who know they want to go on to graduate school, to become a hands-on healthcare provider. Think physician assistant, physical therapist, occupational therapist, pharmacist, or even a doctor. For these students, the health science major is a strategic alternative to a traditional biology or chemistry degree. Why? Because while you're still knocking out all the same hardcore science prerequisites, the anatomy and physiology, the organic chemistry, the microbiology, you're also taking classes that give you a massive advantage. Classes in US healthcare systems, epidemiology, medical ethics, and health communication. When you sit down for your PA school or med school interview, you won't just be another applicant who can recite the Krebs cycle. You'll be the one who can intelligently discuss the challenges of healthcare access in rural America. You'll understand the difference between Medicare and Medicaid. You'll have a foundational knowledge of how the entire system works, not just how one single organ does. It makes you a more well-rounded, aware, and ultimately, a much more compelling candidate for those hyper-competitive graduate programs. It shows you're not just interested in the science, you're interested in the practice of healthcare. But here's where it gets really interesting. The second path is the non-clinical or applied health track. And this, my friends, is the hidden gem. This track is for students who want to graduate with a bachelor's degree and jump directly into a fantastic, well-paying job in the healthcare industry, without ever touching a needle or a scalpel. This is the path for the organizers, the communicators, the analysts, the educators, and the leaders who make the entire healthcare system run. The American healthcare industry is a $4.5 trillion behemoth. It is the largest employer in the country, and the vast majority of the jobs within it are not doctors and nurses. They are the people working in hospital administration, managing budgets for a multi-million-dollar clinical department. They are the corporate wellness consultants hired by Fortune 500 companies to design programs that keep thousands of employees healthy and productive. They are the public health educators working for a county government, creating campaigns to combat vaping or promote vaccination. They are the health data analysts, using big data to track disease outbreaks and predict future health trends. They are patient advocates, medical device sales representatives, health insurance specialists, and nonprofit program managers. These are not just jobs. These are powerful, stable, and often incredibly lucrative careers. And the health science degree is the direct pipeline into this world. It gives you the scientific literacy to understand the field, combined with the practical skills in management, policy, and communication to actually make a difference on a massive scale. So, what is the secret sauce? Why does this one degree open so many different doors? Comes down to the unique blend of skills you walk away with. Unlike a hyper-specialized major that puts you in a tiny box, health science is designed to make you a versatile problem solver. It's a Swiss Army knife degree. You learn the hard sciences, yes. You'll understand human anatomy and disease pathology. But you also learn how to write grants, how to design a health survey, how to analyze statistical data, how to communicate complex scientific information to a lay audience, and how to navigate the labyrinth of healthcare law and ethics. This combination is lethal in the job market. A hospital administrator needs someone who understands both the clinical realities of patient care and the financial realities of a budget. A pharmaceutical company needs a salesperson who can talk intelligently with doctors about medical science, but also build relationships and close deals. A public health agency needs a leader who can grasp the epidemiology of a disease and create a culturally competent communication plan to reach diverse communities. The health science major builds that exact person. It trains you to be the essential connector, the translator between different worlds, which is one of the most valuable roles in any complex industry, especially healthcare. So the question isn't just, can I get a job with a health science degree? The real question is, which of the hundreds of incredible jobs do I want? It offers you options. It gives you the freedom to pivot. You might start out as a health educator and discover you have a passion for data, so you move into a healthcare analyst role. You might begin in hospital administration and realize you want to shape policy on a larger scale, so you pursue a master's in public health. This degree doesn't lock you in. It opens you up. It provides a foundation so broad and so relevant that you can build almost any kind of health-related career on top of it. So let's paint a picture of what that actually looks like. Imagine 3 different students, all graduating with the same Bachelor of Science in Health Science. Let's call them Maya, Ben, and Chloe. They walk across the same stage, shake the same hands, but their paths are about to diverge dramatically, showcasing the sheer power of this degree. First, let's follow Maya. Maya was always fascinated by the mechanics of the human body. In her anatomy and physiology classes, she wasn't just memorizing bones and muscles. She was visualizing how they worked together, how a single injury could create a cascade of problems. She volunteered at a local rehab clinic during her junior year and saw a physical therapist help a grandmother recover from a hip replacement, going from a walker to dancing at her grandson's wedding. That was it. The spark was lit. For Maya, the health science degree was the perfect pre-professional track for physical therapy school. It covered all the prerequisites: biology, chemistry, physics, anatomy. But more than that, it gave her a holistic view of health. She took classes in health ethics, community health, and psychology, which taught her that treating a patient isn't just about the physical injury. It's about understanding their lifestyle, their fears, their motivation. After graduation, Maya buckled down for the GRE and applied to Doctor of Physical Therapy, or DPT programs. It was competitive, but her strong GPA, volunteer hours, and the broad knowledge from her health science major made her a standout applicant. Fast forward 3 years through an intense DPT program filled with clinical rotations in hospitals, outpatient clinics, and nursing homes. Today, Maya is a licensed physical therapist. Her office is a bustling outpatient orthopedic clinic. Her day starts at 8 a.m., reviewing the chart of a high school soccer player who tore his ACL. She spends a full hour with him, not just guiding him through exercises but educating him, building his confidence, and managing his frustration. Her next patient is a construction worker with chronic lower back pain. For him, it's less about intense exercise and more about ergonomics and functional movement, how to lift safely, how to modify his work to prevent re-injury. Later, she works with an elderly patient on balance and strength to prevent falls. Maya is a hands-on problem solver. She's a detective, a coach, and a healer all in one. The pay is solid. The median salary for physical therapists in the US is around $97,000 a year, and the field is projected to grow much faster than the average for all occupations. But for Maya, the real reward is seeing that soccer player get back on the field, or getting a thank you card from the grandmother who can now play with her grandkids without pain. Her health science degree wasn't the end of her education. It was the critical launchpad for a deeply fulfilling, hands-on clinical career. Now let's turn to Ben. Ben started college on the pre-med track just like half his freshman class. He loved the science, but as he progressed, he started to notice something. He was more interested in the systems than the symptoms. During a hospital volunteer gig, he wasn't just watching the doctors, he was watching the chaos. He saw how scheduling conflicts delayed patient care, how communication breakdowns between departments led to errors, and how inefficient billing processes caused immense stress for families. He realized he didn't want to fix one patient at a time. He wanted to fix the entire hospital. Ben's health science major gave him the language to understand these problems. His courses in healthcare policy, epidemiology, and healthcare administration opened his eyes to the massive complex machine behind the scenes. He learned about insurance models, patient flow logistics, and quality improvement metrics. He realized that the decisions made in the boardroom could have a bigger impact on community health than the decisions made in the operating room. Instead of studying for the MCAT, Ben studied for the GMAT and applied for a Master of Health Administration program, an MHA. He got into a top program, and his health science background allowed him to hit the ground running. While some of his classmates with business backgrounds struggled with the clinical terminology, Ben was already fluent. Today, Ben is an operations manager at a mid-sized regional hospital. His day is a whirlwind of meetings, spreadsheets, and problem-solving. At 9 a.m., he's meeting with the head of nursing to address a staffing shortage on the surgical floor. At 11 a.m., he's analyzing data on patient readmission rates, trying to identify patterns and implement strategies to improve long-term outcomes. In the afternoon, he's negotiating with a vendor for new MRI equipment, balancing a multi-million-dollar budget with the need for cutting-edge technology. Ben doesn't wear scrubs or a white coat. His tool isn't a stethoscope, it's a spreadsheet. But his work is life or death. A more efficient emergency room protocol that he helps design could shave minutes off the time it takes to treat a heart attack patient. A better infection control policy he implements could prevent dozens of patients from getting sick. He's a conductor of a complex orchestra, ensuring all the different sections, doctors, nurses, technicians, finance, are playing in harmony. The career path for healthcare administrators is incredibly strong. The Bureau of Labor Statistics projects the field to grow by a staggering 28% over the next decade. The median pay is over $106,000 a year, with senior executives and hospital CEOs earning significantly more. For Ben, the health science degree was his entry point into the business of saving lives, proving that you don't need to hold a scalpel to make a massive impact. Finally, let's look at Chloe. Chloe is a digital native. She grew up with a smartphone in her hand, and she's always been fascinated by how technology can solve human problems. In her health science classes, as she learned about chronic disease management and public health communication, her mind kept jumping to the same question. Isn't there an app for that? She saw the disconnect between the healthcare system, with its fax machines and cumbersome paper records, and the seamless digital world she lived in. Chloe's capstone project for her health science degree was a proposal for a mobile app to help diabetic teenagers manage their blood sugar, incorporating gamification and social support. Her professors were blown away. They saw that she had a rare ability to bridge the gap between clinical knowledge and user-centered tech design. After graduation, Chloe didn't apply to grad school. Instead, she took a few online courses in data analytics and user interface design. She built a portfolio and started applying to health tech startups. Her health science degree was her secret weapon. Tech companies had plenty of brilliant coders, but they desperately needed people who actually understood the healthcare landscape, the privacy laws like HIPAA, the complexities of patient behavior, and the workflows of clinicians. Chloe understood all of it. Today, Chloe is a product manager at a fast-growing digital health company that creates remote patient monitoring software. Her job is to be the voice of the user, She spends her mornings talking to nurses and doctors to understand their pain points with current technology. She spends her afternoons in strategy sessions with software engineers and designers, translating clinical needs into technical specifications. She'll run a focus group with cardiac patients one day and analyze user engagement data the next. She's at the absolute cutting edge of healthcare innovation. The platform she's helping to build allows doctors to monitor a patient's vital signs from hundreds of miles away, catching problems early and preventing costly, life-threatening hospitalizations. She's helping to build the future of medicine, a future that is more proactive, personalized, and accessible. Careers in health informatics and for medical and health services managers are booming, with salaries often exceeding $100,000, especially with experience in the tech sector. For Chloe, the health science degree wasn't a pathway to a traditional job. It was a toolkit that allowed her to invent her own. It gave her the credibility and foundational knowledge to step into one of the most exciting and rapidly evolving sectors of the economy. So you have 3 graduates, 1 degree: Maya, the hands-on healer; Ben, the systems-level strategist; and Chloe, the tech-savvy innovator. Each of them found a way to turn their passion into a high-impact, successful career. Their stories aren't exceptions. They are examples of the incredible versatility you get with a degree in health science. Let's break down what that versatility actually looks like. When most people hear health science, their minds jump to one place: the hospital. They picture stethoscopes, scrubs, and the beeping of heart monitors. And they're not wrong, but they're only seeing one small corner of a massive, sprawling universe of opportunity. To really understand the power of this degree, we need to think about the world of healthcare not as a single building, but as 3 distinct, yet interconnected, realms. First, you have the realm of direct patient care. This is the front line. This is where you are hands-on, face-to-face, making a direct, tangible impact on an individual's life. This is Maya's world. If you're someone who feels a deep, personal calling to help people heal, to be the person they trust in a moment of vulnerability, this is your realm. But even here, the options are way broader than just doctor or nurse. Consider the role of a physician assistant or PA. PAs are like the special forces of healthcare. They are highly trained medical professionals who work on teams with physicians. They can diagnose illnesses, develop and manage treatment plans, prescribe medications, and often serve as a patient's principal healthcare provider. It's an incredible amount of responsibility and autonomy, and the demand is exploding. The U.S. Bureau of Labor Statistics projects a 27% growth in this field over the next decade. That's staggeringly fast. The median pay? Over $128,000 a year. This isn't just a job. It's a high-impact, high-reward career for leaders who want to be at the center of patient care. Or what about becoming a physical therapist? You are literally the person who helps people get back on their feet. You work with a patient who was told they might never walk again after a car accident, and through weeks of grit, science, and encouragement, you watch them take their first unaided step. You help an athlete recover from a career-threatening injury, and see them score the winning goal months later. Physical therapists are masters of the human body's mechanics, designing recovery plans that rebuild strength, relieve pain, and restore mobility. With a median salary of nearly $100,000 and a growth rate that's double the national average, it's a field where you can build a fantastic life while you rebuild others. And we can't forget occupational therapists. They are the unsung heroes of daily life. While a PT might help you walk again, an OT helps you do everything else. Button your shirt, cook a meal, use a computer, and return to the activities that give your life meaning. They are creative problem solvers who help people with injuries, illnesses, or disabilities participate in the things they want and need to do. It's a career of profound empathy and ingenuity, with a solid median salary of over $93,000. These are just a few examples in a realm that also includes radiation therapists, dental hygienists, and respiratory therapists, all vital hands-on careers that a health science degree puts directly within your reach. But what if you're fascinated by healthcare, but the thought of direct patient interaction isn't your thing? What if you're more of a big-picture thinker, a strategist, a builder? This brings us to the second realm, the architects of the health system. These are the people working behind the scenes, not with individual patients, but with the entire system of care. This is Liam's world. They are the managers, the data wizards, and the policymakers who ensure the frontline heroes can actually do their jobs effectively. Think about a healthcare administrator or a health services manager. These are the leaders who run hospitals, clinics, and entire healthcare networks. They manage budgets in the millions or even billions of dollars. They hire and train staff, ensure compliance with complex regulations, and develop strategies to improve patient outcomes across an entire population. They are the ones asking the big questions. How can we reduce wait times in the emergency room? How do we implement a new technology to make our hospital more efficient? How can we provide better care to underserved communities? It's a role that combines business acumen with a deep understanding of the health landscape. And it's a leadership position that commands respect. And a median salary of over $106,000, with some top executives earning well over $200,000. Now let's talk about one of the fastest growing and most exciting fields in this realm: health informatics. This is where Chloe's passion for technology meets the world of medicine. Health informatics specialists are the digital detectives and data storytellers of healthcare. They manage and analyze the colossal amount of health information generated every single day. They work with electronic health records, design systems to protect patient privacy, and use big data to identify trends that can predict disease outbreaks or reveal which treatments are most effective. If the idea of using cutting-edge technology to solve massive health problems gets you excited, this is for you. You are literally building the future of medicine, one line of code and one data model at a time. The demand is surging, and the salaries reflect it, often starting in the high five figures and quickly climbing into the six-figure range for experienced professionals. This realm also includes the crucial work of public health professionals. Think of them as doctors for an entire community. They aren't treating one person's illness. They're working to prevent that illness from ever happening in the first place. They are the epidemiologists who track a virus as it spreads, the policy advisors who campaign for clean air and water, and the community health program managers who launch initiatives to combat obesity or smoking. After the events of the last few years, the world understands the critical importance of public health more than ever. It's a career for people who want to create systemic change and impact the health of thousands or even millions of people at once. Finally, we arrive at the third realm, which is the foundation of knowledge. This is for the endlessly curious, the writers, the educators, and the discoverers. These are the people who don't just practice or manage healthcare. They create and disseminate the very knowledge it's built upon. This is where Liam's analytical mind and Chloe's innovative spirit can truly shine. Have you ever searched for a health symptom online and landed on a clear, easy-to-understand article from a trusted source? A health science writer or a medical communicator probably wrote that. These professionals are expert translators, taking complex scientific research and medical jargon and turning it into content that patients, journalists, and the general public can understand. They write patient education brochures, create content for pharmaceutical companies, develop scripts for health documentaries, and work as journalists for major news outlets. In an age of misinformation, their role as a trusted source of clear, accurate health information is more critical than ever. It's a perfect career for those who love science and have a talent for storytelling. Then there are the health educators. These are the champions of prevention. They work in schools, community centers, nonprofits, and corporations, designing programs that empower people to take control of their own health. They might teach a nutrition class for new parents, develop a stress management workshop for a company's employees, or lead a campaign about the importance of cancer screenings in an underserved neighborhood. They are on the front lines of behavioral change, giving people the tools and knowledge they need to live longer, healthier lives. It's a career driven by purpose and a desire to uplift the entire community. And for those with a burning desire to push the boundaries of what's possible, there's the path of a research scientist. A bachelor's in health science is a perfect launchpad for graduate studies. A master's or a PhD, that can lead to a career in a research lab. You could be working at a university, a pharmaceutical company, or a government agency like the National Institutes of Health, contributing to the next breakthrough in cancer treatment, Alzheimer's research, or vaccine development. You would be part of the global engine of discovery, the person whose work could one day change the standard of care for millions. So you see, it's not just one path. It's a nexus of possibilities. Whether you want to be on the front lines holding a patient's hand, in the boardroom designing a better system, or in the library uncovering the next great discovery, a health science degree is the key that can unlock that door. Each realm offers a different way to make a profound impact. The real question isn't whether there's a career for you in health science. The real question is, which one ignites your passion? So let's start with the first and perhaps most visible realm, the front lines of care. This is for the person who feels a pull, a calling, to be there with patients in their moments of need. If you're energized by human interaction, If you find meaning in being a source of comfort, expertise, and hope, then this is your world. These are the careers where your health science degree becomes the bedrock for hands-on direct impact work. Think about the physical therapist. This isn't just about exercises and stretches. You are the architect of a person's comeback story. Imagine a high school quarterback who tears their ACL in the championship game. Their dream of a college scholarship feels like it's evaporated. You are the one who guides them, not just through the physical pain, but through the crushing doubt. You design the program, you push them when they want to quit, and you are there on the sidelines when they finally step back onto that field. You didn't just heal a knee, you helped restore a dream. To become a doctor of physical therapy, or a DPT, you'll build on your health science bachelor's with a 3-year doctoral program. It's a significant commitment, but the reward is immense. In the United States, the median salary for a physical therapist is over $97,000 a year, and the field is projected to grow by a staggering 16% over the next decade. That's more than 5 times the average for all occupations. Right alongside them is the occupational therapist, or OT. While a PT might help a stroke survivor learn to walk again, the OT helps them learn to live again. They answer the questions that truly define independence. How can I cook a meal for my family again? How can I get dressed by myself? How can I go back to my job? OTs are the ultimate problem solvers of daily life. They might adapt a kitchen for someone in a wheelchair, teach a child with autism the social skills to make a friend, or help a veteran with PTSD manage their anxiety to hold a job. It is profoundly creative and deeply personal work. This path typically requires a master's degree in occupational therapy. The pay is excellent, with a median salary around $93,000, and the job outlook is just as bright as physical therapy, with a projected growth of 12%. Now, maybe you want that direct patient interaction, but you also crave a broader scope of medical practice, a role that puts you right at the heart of diagnosis and treatment. Then you need to seriously consider becoming a physician assistant, or PA. PAs are one of the most dynamic and in-demand professions in all of healthcare. Working in collaboration with physicians, PAs take medical histories, conduct exams, diagnose illnesses, develop treatment plans, and can even prescribe medication. They work in virtually every specialty imaginable, from family medicine in a rural town where they might be the main provider for hundreds of families, to assisting in complex heart surgeries in a major urban hospital. The versatility is unmatched. Your health science degree provides the perfect pre-PA foundation. After that, it's a 2 to 3 year master's program. And the payoff? The median salary for a PA in the US is over $128,000 a year. The demand is explosive, with the Bureau of Labor Statistics projecting a 27% growth over the next decade. That translates to over 39,000 new jobs. It's a pathway to practice medicine with incredible responsibility, great work-life balance, and a fraction of the time and debt of medical school. But patient care isn't always about treatment. Sometimes it's about discovery. It's about seeing inside the human body to find the answers. This is the world of the diagnostic professionals. Take the radiologic technologist, the expert who performs X-rays, CT scans, and MRIs. You are the eyes of the medical team. A patient comes into the ER with severe abdominal pain. The doctor is running through a dozen possibilities. But you are the one who performs the CT scan, and with skill and precision, you capture the image that reveals the telltale signs of appendicitis, allowing for life-saving surgery. It's a role that requires a deep understanding of anatomy, technology, and patient safety. You can enter this field with an associate's or a bachelor's degree, making it one of the more accessible high-impact careers. The median pay is over $73,000 a year. Similarly, a diagnostic medical sonographer uses ultrasound technology to create images of the body's tissues and organs. The most well-known use is in obstetrics, where you are the very first person to show expectant parents the image of their child. You're there for one of the most joyful moments in their lives. But you're also the skilled professional who can detect a potential heart defect in that same fetus, giving the medical team weeks to prepare a plan to save that baby's life the moment it's born. You could be scanning for blood clots, examining organ function, or guiding a surgeon's needle during a biopsy. It's a career that demands incredible hand-eye coordination and a sharp analytical mind. Most roles require an associate's or bachelor's degree, and the median salary is impressive, at over $84,000, with a strong 10% job growth. The front lines of care also include the specialists who focus on specific, vital aspects of our health. Think about the respiratory therapist, When a premature baby is born with underdeveloped lungs, the respiratory therapist is the one managing the ventilator, keeping them breathing. When a person with chronic asthma has a severe attack, you are the one administering the life-saving treatments in the ER. During the height of the COVID-19 pandemic, respiratory therapists were the unsung heroes on the absolute front lines, managing the most critical patients. It's a high-stakes, high-reward career that typically requires an associate's degree, with a median salary of over $74,000 and a projected growth of a whopping 14%. Then there's the dental hygienist. This is so much more than cleaning teeth. You are a primary line of defense in preventative healthcare. You educate patients on habits that will save them from pain and costly procedures down the road. But more than that, you can be the first to spot signs of serious systemic diseases, like diabetes or even oral cancer, just by examining a patient's mouth. An associate's degree in dental hygiene is the most common path, leading to a median salary of over $87,000. And we can't forget the power of food as medicine. As a registered dietitian or nutritionist, you use evidence-based science to help people manage chronic diseases like heart disease and diabetes, achieve a healthy weight, or optimize their athletic performance. You might work in a hospital counseling a patient after a heart attack on a new way of eating, or you could work in a corporate wellness program, helping hundreds of employees build healthier lifestyles. Or you might even work with an elite sports team, fine-tuning the nutrition that gives them a competitive edge. This path requires a bachelor's degree, a supervised internship, and passing a national exam. The impact you can have is life-changing, and it's a field with steady growth and a median salary of nearly $70,000. All of these roles, from PTs to PAs to sonographers, share a common beating heart. They are about the human connection. They are for people who need to see the results of their work in the face of the person they are helping. It's about the tangible moment of success, the patient taking their first step, the clear diagnostic image, the sigh of relief, the handshake of gratitude. This is the reward. This is the why for those who choose the front lines. But what if your passion for health is bigger than one-on-one interaction? What if you don't want to just treat the person who is already sick, but you want to stop the sickness from spreading in the first place? What if your goal is to protect not just one life, but the health of an entire community, a city, or even a nation? For that, we have to move beyond the clinic walls and into a completely different realm of health science. This is the world of public health. It's the silent, often invisible force working 24/7 to keep you safe. It's the reason you can drink water from your tap without a second thought, why you don't have to worry about polio when you send your kids to school, and why there are seatbelt laws that save thousands of lives every year. While a doctor treats an individual patient, a public health professional treats an entire community. Think of it this way, and this is the single most important analogy in the entire field. Imagine a river. Downstream, doctors are heroically pulling people out of the water, one by one, saving them from drowning. They are essential, they are lifesavers. But the public health professional? They don't stand by the riverbank. They walk upstream. They walk upstream to find out why so many people are falling into the river in the first place. Is the bridge broken? Is the path slippery? Is someone pushing them in? And then they build a fence, they fix the bridge, they put up a warning sign. They solve the problem at its source. A health science major can be your ticket to becoming one of those people who walks upstream. This path often leads to a master's in public health or an MPH, and your undergrad degree in health science is the perfect launchpad for it, giving you the broad foundation you need. So what does it actually look like to be one of these upstream thinkers? Let's break down the 5 core pillars of public health, because this isn't one single job. It's an entire universe of careers. First, you have the disease detectives, the epidemiologists. These are the people you see in movies during a viral outbreak, the ones drawing lines on maps and connecting the dots that no one else can see. Epidemiology is the study of how diseases and health conditions are distributed in populations, and the factors that influence that distribution. When a mysterious illness pops up in a town, it's the epidemiologist who goes in, interviews people, collects data, and traces the outbreak back to its source. They're part Sherlock Holmes, part data scientist. They were the ones who figured out that a contaminated water pump on Broad Street in London was the source of a deadly cholera outbreak in 1854. They were the ones who linked smoking to lung cancer. And today, they're the ones tracking new variants of COVID-19, figuring out why one neighborhood has a higher rate of asthma than another, or tracing a salmonella outbreak back to a single batch of spinach. If you love solving puzzles, if you see patterns where others see chaos, And if you're fascinated by the story that data can tell, epidemiology could be your calling. But epidemiologists can't do their work alone. They need the second pillar, the math wizards, the biostatisticians. If epidemiology asks the what, where, and why, biostatistics provides the how sure are we. Biostatisticians are the guardians of scientific truth. They design the studies, from massive clinical trials for a new cancer drug to community-level surveys on mental health. They take a mountain of raw, messy data and use powerful statistical models to find the real signal in the noise. Was the new vaccine truly effective, or was the result just random chance? Does this new health policy actually reduce hospital admissions, or are there other factors at play? They are the ones who can say with a specific degree of confidence whether an intervention works or not. This field is incredibly rigorous, demanding a love for numbers, logic, and precision. And because of that, it is one of the most in-demand and highest-paying fields in all of health science. Every single pharmaceutical company, every major hospital, every government health agency like the CDC or NIH, is desperate for skilled biostatisticians. Our third pillar moves from the data to the world around us, environmental health. These are the protectors of the fundamental building blocks of our health: the air we breathe, the water we drink, and the food we eat. This is where health science gets its hands dirty, in the best way possible. An environmental health specialist might be the person who inspects restaurants to prevent foodborne illness, the scientist who tests a city's drinking water for lead after seeing a spike in childhood developmental issues, or the expert who studies the health impacts of air pollution from wildfires or industrial plants. They investigate workplace safety to ensure people aren't being exposed to harmful chemicals on the job. They are on the front lines of climate change, studying how rising temperatures and extreme weather events impact human health, from heat stroke to the spread of insect-borne diseases. If you are passionate about the environment and see the undeniable link between the health of the planet and the health of its people, this is a field where you can make a tangible, visible difference every single day. Fourth, we have the architects of the system, health policy and management. You can have the best science and the most brilliant doctors in the world, but if the system itself is broken, people will still suffer. This is the domain of leaders, administrators, and advocates. Professionals in this field work to design, implement, and evaluate the laws, regulations, and structures that govern our healthcare. They ask the big questions. How do we ensure everyone has access to affordable healthcare? What's the most efficient way to run a hospital system to maximize patient outcomes and minimize costs? How do we write legislation that promotes mental health parity or funds pandemic preparedness? You'll find these professionals working as hospital administrators, managing multi-million-dollar budgets and hundreds of staff. You'll find them in Washington, D.C. or your state capital, advising lawmakers on health legislation. You'll find them at nonprofits, advocating for policies that protect the most vulnerable populations. If you have a mind for business, law, or politics but a heart for health and social justice, this is how you change the entire game, not just for one patient but for millions. Finally, and perhaps most importantly, we have the fifth pillar, the one that deals with the most complex variable of all, us. This is social and behavioral science and health promotion. This field recognizes that health isn't just about germs or genes. It's about choices, culture, and community. Why do people smoke when they know it's bad for them? How can we design a program that effectively encourages teenagers to eat healthier and exercise more? What are the social factors like poverty or education that lead to massive health disparities between different groups? These are the communicators, the educators, and the community organizers of public health. They create the powerful anti-smoking campaigns that change a generation's attitude. They develop culturally sensitive diabetes prevention programs in underserved communities. They use psychology and sociology to understand human behavior, and then use that knowledge to empower people to make healthier choices. If you are a people person, a gifted communicator, and you believe that the key to better health lies in understanding and changing human behavior, this is your path. So imagine a city facing a new health crisis. The epidemiologist is the detective tracking the spread. The biostatistician is the analyst quantifying the risk. The environmental health specialist is the investigator, checking the physical surroundings. The health policy expert is the commander, organizing the system-wide response. And the health promotion specialist is the communicator, getting the right information to the public to keep them safe. They are all different, yet they are all essential parts of the same shield. A health science major gives you the vocabulary of all 5 of these languages, preparing you to step into this world and find your place in protecting the health of everyone. But building this shield requires more than just people and policies. It requires tools, technology, and groundbreaking discoveries. What if your passion lies not in the clinic or the community, but in the laboratory or the server room, creating the very innovations that power modern medicine? This is where the innovators, the builders, and the digital detectives thrive. Welcome to the other side of healthcare, the world of health technology and research. This isn't about bedside manner. It's about building the bed itself, designing the monitor that tracks the heartbeat, and writing the code that predicts the next pandemic. Let's start with the tangible. Think about the most advanced piece of medical technology you can imagine. A prosthetic arm that can feel, a pacemaker the size of a grain of rice, an MRI machine that can map the brain's connections in real time. These aren't magic. They are the products of minds that live at the intersection of biology and engineering. This is the world of the biomedical equipment technician, or the medical device specialist. A health science degree provides the perfect foundation for this field because you understand the why behind the what. You don't just see a collection of circuits and plastics. You see a tool that has to integrate flawlessly with the most complex machine on Earth, the human body. You understand the physiology of a failing kidney, which is why you can help design a better dialysis machine. You understand the biomechanics of a knee joint, which is why you can work for a company developing revolutionary joint replacements. Your day-to-day might not involve talking to patients, but your work talks to their bodies directly. You could be a clinical application specialist training surgeons on how to use a new robotic surgery system. You're the one in the operating room, not with a scalpel, but with a tablet and a deep knowledge of both the technology and the anatomy, ensuring the surgeon can perform miracles. Or you could be in medical device sales, not just selling a product, but educating entire hospital systems on a technology that could save thousands of lives, explaining the clinical data and patient outcomes with the authority of someone who truly understands health. This path is for the problem solvers, the tinkerers, the ones who took things apart as kids just to see how they worked. It's for people who see a limitation in healthcare and their first thought is, I can build something to fix that. You're not just supporting the healthcare system. You're literally building its future, one device, one sensor, one life-changing invention at a time. But what if the tools you want to build aren't physical? What if they're made of data? We live in an age of information. Every doctor's visit, every lab result, every prescription filled generates a data point. Multiplied by millions of patients over decades, this creates an ocean of information so vast it's impossible for any single human to comprehend. But within that ocean are the answers to medicine's biggest questions. And the people who can navigate that ocean are the health informaticists and clinical data analysts. This is one of the fastest growing and most critical fields in all of healthcare. A health science major gives you a massive advantage here because, again, you understand the context behind the code. You're not just a data scientist who sees numbers. You're a health scientist who sees patients in the patterns. Imagine this. A hospital is seeing a spike in readmission rates for heart failure patients. The administrators are stumped. A pure data analyst might look at demographic data or insurance types. But you, with your health science background, know to look deeper. You start cross-referencing the data. You look at prescription adherence records, follow-up appointment schedules, even dietary notes from the cafeteria. You discover a pattern. Patients prescribed a specific diuretic who also live in a certain zip code, a known food desert, are the ones coming back. The problem isn't just medical. It's socioeconomic. It's a nutrition issue. With that insight, the hospital can now create a targeted intervention program, partnering with local food banks to deliver healthy meals to these at-risk patients. You didn't just analyze data. You potentially saved lives and saved the hospital millions of dollars, all from behind a computer screen. This is the power of health informatics. You could be working to build and manage the electronic health record systems that doctors use every single day, making them more intuitive and less prone to error. You could work for a public health agency, using massive datasets to track a viral outbreak in real time, predicting where it will spread next, and allowing officials to allocate resources before it's too late. Or you could work for a research institution, analyzing genomic data from thousands of cancer patients to identify the subtle genetic markers that predict which new immunotherapy drug will be most effective for whom. This career is for the digital detective, the pattern seeker, the person who loves solving complex puzzles. It requires a meticulous, analytical mind, but also the empathy to remember that every single data point represents a human being. From the physical to the digital, we now go to the molecular. Let's talk about the world of pharmaceuticals and biotechnology. Every pill in your medicine cabinet, every vaccine you've ever received, is the end result of a long, grueling, and heroic journey that began in a laboratory. And health science majors are critical at every single step of that journey. Many people think you need a hardcore PhD in chemistry or biology to work in pharma, and while those roles are essential, they are just one part of a massive ecosystem. As a health science graduate, you are the ultimate utility player. You have the scientific literacy to understand the mechanism of a new drug, but also the broader perspective to see its path to the patient. You could work as a clinical research coordinator. You're the on-the-ground general for a clinical trial, the person who ensures a groundbreaking new cancer drug is tested safely and effectively. You work with doctors, nurses, and patients, managing data, ensuring protocols are followed, and serving as the vital link between the laboratory's discovery and its real-world application. You are the gatekeeper of medical progress. Or maybe you're drawn to the world of regulatory affairs. This is for the meticulous, rule-oriented mind. You are the expert who prepares the mountains of documentation required by the Food and Drug Administration, the FDA. You translate the complex scientific data into the precise language the government requires to approve a new drug. It's a high-stakes, detail-obsessed job, because a single mistake can delay a life-saving medication for months or even years. You are the diplomat between innovation and regulation. Perhaps you're interested in quality control and assurance. You work inside the manufacturing plant, testing batches of a new vaccine or medication to ensure every single vial is perfect, pure, and potent. It's a role of immense responsibility, protecting the public from contamination or error. You are the silent guardian of patient safety. These roles, in medical devices, in health informatics, and pharmaceuticals, are for those who want to impact millions without necessarily seeing a single patient. Your patient is the system itself. You fix the tools, you analyze the trends, you shepherd the cures. Your work creates a ripple effect, where one innovation, one insight, or one approved drug can change the standard of care for generations to come. Your passion might not be for the one-on-one interaction, but for the one-to-many impact. So you have to ask yourself, are you a builder, a detective, or a pioneer? Do you want to shape the tools of medicine, decode its secrets, or discover its future cures? Because a health science degree can be your key to unlocking any of these doors. But what if your greatest tool isn't a device, a dataset, or a drug? What if your greatest strength is your voice? What if you're meant to be a translator, a guide, and an advocate in the complex world of health? If you are that person, then welcome to the heart of healthcare. Because for every brilliant scientist in a lab and every skilled surgeon in an operating room, there is an equally vital professional whose job is to bridge the gap between medicine and humanity. These are the communicators, the educators, and the advocates. A health science degree doesn't just teach you about the body. It teaches you how to talk about it, how to explain it, and how to help people navigate their own health journeys. Let's start with one of the most impactful roles you might never have heard of: the health educator. Forget the stereotype of someone handing out pamphlets in a clinic hallway. A modern health educator is a strategist, a community organizer, and a force for change. Imagine a town where rates of type 2 diabetes are skyrocketing. A doctor can prescribe medication, but a health educator goes deeper. They go into the community. They work with local grocery stores to promote healthier options. They partner with schools to revamp lunch programs and PE classes. They organize free, public workshops on nutrition and exercise, not as dry lectures, but as interactive cooking classes or community walking groups. They don't just treat the symptom. They work to change the environment that causes the disease. They are the architects of public wellness. As a health educator, you're not waiting for people to get sick. You are actively building a healthier world, one neighborhood at a time. The U.S. Bureau of Labor Statistics projects this field to grow significantly faster than the average for all occupations, because we're finally realizing that prevention is just as important, if not more important, than a cure. Your health science degree gives you the scientific credibility to understand the why behind the advice, and the communication skills to translate that why into action people can take in their everyday lives. But what if you want to be more of a one-on-one guide? What if you want to be the champion for a single person lost in the storm of a medical crisis? Then you might be destined to become a patient advocate or a patient navigator. The American healthcare system is a labyrinth. It's a maze of specialists, insurance pre-authorizations, confusing medical bills, and clinical jargon. For a patient who is already sick, scared, and vulnerable, navigating this system can feel impossible. It can be a full-time job that they are too ill to do. This is where the patient advocate steps in. You become their personal guide, their translator, and their warrior. You're the one on the phone for hours with an insurance company, fighting a denied claim. You're the one sitting in the consultation with the oncologist, taking notes and asking the tough questions the family is too overwhelmed to think of. You're the one who helps them find financial assistance programs, coordinates transportation to appointments, and explains what a deductible versus a copay actually means in the real world. You are the human buffer between a vulnerable person and a cold, complex system. You don't provide medical care, but the support you provide is just as critical to healing. You ensure that the only thing a patient has to focus on is getting better. A health science major is the perfect training ground for this, giving you a broad understanding of medical terminology, disease processes, and the very structure of the healthcare system you'll be helping patients conquer. Now let's scale that up. What if your voice could reach not just one person or one community but millions at a time? This is the world of the health communication specialist. These are the master storytellers and translators working behind the scenes at a massive scale. Think about the last time you visited the website for the Centers for Disease Control or the Mayo Clinic. Who wrote that clear, easy-to-understand article that explained a complex condition? A health communication specialist. Think about a major public health campaign like efforts to reduce smoking or encourage vaccinations. Who created the messaging, the social media posts, the television ads that resonated with the public and changed behavior? A health communication specialist. They work for hospitals, nonprofits, government agencies, and pharmaceutical companies. Their job is to take dense, scientific, and often intimidating information and transform it into content that is clear, compelling, and actionable for the general public. During a global pandemic, they are the voice of calm and clarity. During a new drug launch, they are the ones who explain its benefits and risks to both doctors and patients. They are medical writers, social media managers, and public relations experts all rolled into one. They fight misinformation with facts, and they replace fear with understanding. To do this, you need a dual fluency. You must speak the language of science and the language of people. A health science degree is built on this very principle, providing the scientific foundation needed to be accurate and the liberal arts exposure needed to be an effective communicator. These three paths, the educator, the advocate, and the communicator, are fundamentally about connection. They are about recognizing that healthcare isn't just about cells and systems. It's about people. It's about culture, fear, hope, and trust. Your greatest tool in these roles is empathy. It's the ability to listen to what's not being said, to understand the cultural barriers that might prevent someone from seeking care, to feel the frustration of a family trying to make the right decision with limited information. Your health science curriculum, with its blend of hard science and social science courses like sociology and psychology, is uniquely designed to build this empathetic muscle. You learn not just how the body works but how people work. You learn how social determinants of health, things like income, education, and where you live, can have a greater impact on a person's well-being than their genetic code. This holistic perspective is what separates a good healthcare professional from a great one. It's the understanding that you can't just treat a diagnosis, you have to care for a whole person living a complex life. So, if you're the person in your friend group who everyone comes to for advice, the one who can explain complicated ideas in a simple way, the one who isn't afraid to speak up for others, then this entire side of the health science world could be calling your name. It's a path for those who believe that information is power, and that clear, compassionate communication can be a form of medicine in itself. It's not about wielding a scalpel or a syringe, but about wielding words and understanding to heal, to empower, and to guide. It's about being the steady, knowledgeable voice in a room full of uncertainty. But these roles all operate within a larger structure. The educator needs a community center to work in. The advocate needs a hospital system to navigate. The communicator needs a public health agency to work for. Who builds and manages these massive, intricate systems? Who are the leaders, the visionaries, and the architects that design the very framework of our healthcare? They aren't on the front lines with patients, but their decisions impact every single person who walks through the clinic doors. They are the ones who manage the budget, set the policies, and ensure the entire orchestra of care plays in harmony. They are the conductors, the CEOs, the strategic minds of the medical world. We're talking about healthcare administrators and health services managers. This is one of the most powerful and often overlooked career paths for a health science major. It's for the person who sees the bigger picture, who loves solving complex puzzles not with a scalpel, but with a spreadsheet, a strategic plan, and the ability to lead a team of brilliant, highly specialized professionals. If the idea of managing a multi-million-dollar budget for a hospital department developing policies that improve patient safety across an entire clinic system, or negotiating with insurance companies and equipment suppliers gets your heart racing more than drawing blood, then you need to listen very, very closely. A health science degree provides the perfect foundation for this role. Why? Because to effectively manage a healthcare organization, you have to understand the language of medicine. You need to know the difference between an MRI and a CT scan, not because you'll be operating them, but because you'll be deciding which multi-million-dollar machine to purchase. You need to understand the workflow of a nurse, a therapist, and a physician, not because you'll be doing their jobs, but because you'll be responsible for creating a system where they can do their jobs to the absolute best of their ability, without burnout and with maximum efficiency. Your health science curriculum, your anatomy, your medical terminology, your understanding of the U.S. healthcare system, is your ticket to credibility in a boardroom full of clinicians. So, what does this career path actually look like? At the entry level with a bachelor's in health science, you might start as a clinical department manager, a patient relations representative, or an administrative assistant in a hospital's executive office. You're learning the ropes, understanding the day-to-day operations, and seeing firsthand the challenges that need to be solved. But the real power, the real influence, and the big salaries in this field often come with a master's degree. We're talking about a Master of Health Administration, or MHA. Think of it as an MBA, but specifically tailored for the incredibly complex trillion-dollar business of healthcare. An MHA program will teach you healthcare finance, strategic planning, health law and ethics, and organizational leadership. It's the degree that takes your foundational scientific knowledge and transforms you into an executive. And the demand? It's explosive. The Bureau of Labor Statistics projects the employment of medical and health services managers to grow by a staggering 28% from 2022 to 2032. That's not a typo. 28%. That is vastly, astronomically faster than the average for all occupations. The reason is simple. As our population ages and medical treatments become more complex, the need for skilled professionals to manage the delivery of that care is skyrocketing. Let's talk numbers. The median annual wage for medical and health services managers was over $106,000 in May 2022. The top 10% earned more than $214,000 a year. This isn't just a career. It's a pathway to significant financial success and influence, all built on the foundation of improving people's health. But this path isn't for everyone. It requires a unique blend of skills. You need to be a leader who can inspire a team. You need to be a diplomat who can navigate conflicts between doctors, nurses, and board members. You need to be a financial wizard who can read a profit and loss statement and find cost-saving measures that don't compromise patient care. You need to be cool under pressure, because when a public health crisis hits or the hospital's accreditation is on the line, everyone will be looking to you for answers. Let's step away from the purely administrative for a moment, because the business side of a health science degree branches out into some of the most cutting-edge fields in the entire industry. One of the hottest areas right now is health informatics. Think about the sheer volume of data generated in healthcare every single day. Every patient visit, every lab result, every prescription, every vital sign reading, it all becomes data. Health informatics is the science of managing and interpreting that data to improve patient outcomes. It's where healthcare, information technology, and business intersect. As a health informatics specialist, you're not just a data manager. You're a digital detective and a strategic analyst. You might be responsible for implementing and managing a hospital's electronic health record, or EHR system, ensuring that a patient's information is secure, accurate, and instantly accessible to their entire care team. You could be using big data to identify trends, for instance, noticing a spike in flu cases in a specific zip code, allowing public health officials to target their resources more effectively. Or you might work on the clinical side, developing systems that flag potential drug interactions for doctors before they even write a prescription, preventing dangerous errors and literally saving lives with code and data. The skills you need here are a mix of your health science background and a strong aptitude for technology. You need to be analytical, detail-oriented, and a fantastic problem solver. You'll be the bridge between the clinical staff who use the technology and the IT professionals who build it. A health science degree gives you the clinical context to be an incredibly effective translator. The career prospects are, again, fantastic, with roles like clinical analyst, data scientist, and chief information officer of a hospital system being long-term goals. Now let's pivot to another area, public health. While a healthcare administrator focuses on an organization, a public health professional focuses on the health of an entire population. This is the macro-level view. If you're the kind of person who is passionate about social justice, preventing disease before it starts, and shaping the policies that affect millions, this is a path to consider. With a health science degree, you could work for a county health department, the Centers for Disease Control and Prevention, the CDC, or a nonprofit organization like the American Heart Association. Your job might involve designing a public awareness campaign to encourage vaccination. You could be a health educator going into schools to teach kids about nutrition and exercise. You might become a policy advisor, analyzing data and research to help lawmakers create smarter health policies, like smoke-free air laws or regulations to ensure safe drinking water. This work is profoundly meaningful. You might not be treating individual patients, but your work could prevent thousands of people from ever getting sick in the first place. It's a long-term game of strategy, education, and advocacy. It requires strong communication skills, a passion for research, and the ability to understand how social, economic, and environmental factors impact a community's health. The path often leads to a Master of Public Health or MPH, which opens up leadership roles in epidemiology, global health, and health policy. Finally, let's talk about an option for the competitive, outgoing, and persuasive health science graduate: medical and pharmaceutical sales. Don't let the word sales fool you. This is a highly sophisticated and scientific profession. You're not selling a product, you're selling a solution. As a representative for a medical device company, you might be in the operating room standing alongside a surgeon, providing technical expertise on how to use a new robotic surgical arm or a revolutionary artificial joint. As a pharmaceutical rep, you're not just dropping off samples, you're educating physicians on the complex pharmacology of a new drug, presenting clinical trial data, and explaining how it can be a better option for their patients with a specific condition. Your health science degree is your ultimate asset here. You can speak the language of the doctors and clinicians you're selling to. You understand the science behind your product on a deep level, allowing you to build trust and be seen as a valuable resource, not just a salesperson. This career is not for the faint of heart. It's performance-driven, with your income often tied to commissions. It requires constant travel, incredible self-discipline, and the ability to handle rejection. But for the right personality, the rewards are immense. It offers a high degree of autonomy, the chance to be on the cutting edge of medical innovation, and a six-figure earning potential that can be reached relatively early in your career. It combines your love of science with the thrill of business and human interaction. So from the CEO's office to the front lines of a public health crisis, from the digital world of data to the high-stakes world of medical sales, the opportunities that branch off from a health science degree are vast and varied. They are for the leaders, the innovators, the advocates, and the communicators. These are the roles that shape the very system of healthcare itself. The question you have to ask yourself is not just, do I want to help people? But, how do I want to help people? Do you want to be the one holding the scalpel, or the one who built the world-class operating room where it's used? So let's break down that how. Let's explore the different personalities, the different mindsets, that thrive under the massive umbrella of a health science degree. Because finding the right career isn't about fitting yourself into a box. It's about finding the box that was built for you. Think of these as different archetypes. See if you recognize yourself in any of them. First, are you the strategist? The big picture thinker. You're the person who looks at a chaotic system and instinctively starts seeing patterns, inefficiencies, and opportunities for improvement. You might not be the one performing the surgery, but you're fascinated by what it takes to run the hospital where the surgery happens. You love data. You see spreadsheets not as boring grids of numbers, but as a story waiting to be told. A story about patient outcomes, resource allocation, and operational flow. If this sounds like you, then the world of healthcare administration and management is calling your name. As a hospital administrator, a clinic manager, or a health services manager, you are the conductor of the orchestra. Doctors, nurses, and technicians are the brilliant musicians, but you're the one making sure they have the instruments, the sheet music, and the stage to perform on. You make decisions that impact thousands. For example, a strategist might analyze emergency room wait times and discover a bottleneck in the patient intake process. By redesigning that process, maybe by implementing a new software system or restructuring the staffing schedule, you could cut wait times in half. You never once touched a patient, but you just drastically improved the care for every single person who walks through that door, and you potentially save lives by getting critical patients to a doctor faster. This path leads to roles like Health Information Manager, where you're the guardian of critical patient data, ensuring its accuracy, security, and accessibility. or a public health analyst, working for a government agency to track disease outbreaks and develop large-scale intervention strategies. These are leadership roles. They require a mind for business, logistics, and policy. The financial rewards can be significant, with medical and health services managers often earning well into six figures. But the real reward for the strategist is the scale of your impact. You're not just fixing one person's problem, you're optimizing the entire system of care. But maybe that feels too distant for you. Maybe you're not the strategist. Maybe you are the advocate. You are fueled by a fire for justice and a deep, personal empathy for the individual. When you see someone struggling, your first instinct is to step in and help them navigate the storm. The idea of fighting a faceless insurance company on behalf of a terrified family doesn't intimidate you. It energizes you. You believe that healthcare is a human right, and you want to be on the front lines, ensuring everyone gets the care they deserve, regardless of their income, language, or background. If you're the advocate, you're not looking at spreadsheets, you're looking into people's eyes. You would thrive as a patient advocate, a role where you become the liaison between patients and the bewildering healthcare system. You help them understand their diagnosis, schedule appointments, decipher medical bills, and fight for coverage. You are their voice when they are too sick or overwhelmed to speak for themselves. Or consider becoming a community health worker or health educator. In these roles, you go directly into communities, often underserved ones, and bridge the gap between people and health services. You might run a diabetes prevention workshop at a community center, connect an elderly person with transportation to their doctor's appointments, or teach new parents about childhood nutrition. This path is about building trust and empowering people. It's about meeting them where they are. The impact is incredibly direct and personal. You will know the names and stories of the people you help. You will see the relief on a mother's face when you find a way to get her child's expensive medication covered. This isn't always the highest paying corner of the healthcare world. But for the advocate, the fulfillment is immeasurable. It's the knowledge that you are a lifeline for people in their most vulnerable moments. Then there's our third archetype, the innovator, the builder, the problem solver, the tech enthusiast. You see the healthcare system not just as it is, but as what it could be. You're fascinated by technology and how it can be leveraged to create better, faster, more efficient solutions. You're the person who thinks, there has to be an app for that. And if there isn't, you start thinking about how to build it. You're less interested in the current rules of the game, and more interested in inventing a whole new one. For the innovator, a health science degree is a launchpad into the booming field of health informatics and health technology. As a health informatics specialist, you work at the intersection of information science, computer science, and healthcare. You might design and manage the electronic health record systems that hospitals rely on. Or you might be a data analyst, using machine learning to predict which patients are at the highest risk for a certain disease, allowing for early intervention. Your work could lead to a new telehealth platform that connects rural patients with world-class specialists hundreds of miles away. This path also includes careers in medical device or pharmaceutical sales. Don't let the word sales fool you. This is a highly technical and consultative role. You are the expert who goes into a hospital and teaches a team of surgeons how to use a new life-saving robotic arm. You are the one who explains the complex science behind a breakthrough drug to a group of physicians. To succeed, you have to be a master of the technology and a brilliant communicator. For the true innovator, the ultimate goal might even be entrepreneurship, founding a startup to solve a problem you've identified. The impact of the innovator is about scalability. One well-designed piece of software, one revolutionary medical device, can improve the standard of care for millions of people at once. Finally, what if your greatest strength is the art of translation? What if you are the communicator? You have a gift for taking dense, complex, intimidating information and making it clear, concise, and understandable. You know how to tell a story, how to persuade, and how to educate. In a field filled with jargon and complexity, your skills are not just valuable, they are absolutely essential. The greatest medical discovery in the world is useless if it can't be communicated effectively to the people who need it. As a communicator, you could become a medical or technical writer. You might be the person who writes the instructions for a new prescription medication, using language so clear that an anxious patient can understand exactly how to take it safely. You could write patient education materials, website content for a hospital, or even grant proposals to fund critical research. Your words literally guide patient care and fuel scientific progress. Or you could pursue a career in health journalism, reporting on medical breakthroughs and public health issues for a news outlet. shaping public understanding and policy. Another powerful avenue is corporate wellness. Companies are increasingly investing in the health of their employees, and they need skilled communicators to design and run these programs. As a corporate wellness coordinator, you'd create campaigns to promote exercise, healthy eating, and mental health support within a company. You're essentially the health educator for an entire organization, improving hundreds of lives and boosting productivity at the same time. For the communicator, the goal is to bridge the gap between knowledge and action. You are the translator who ensures that the brilliant work being done in labs and clinics actually makes a difference in the real world. Strategist, advocate, innovator, communicator. For very different ways to make an impact, all branching from a health science degree. You might see yourself clearly in one, or you might be a blend of two or three. And that's the beauty of it. This field is vast enough to have a place for all of them. But identifying your core nature, your how, is the first step. However, there is one final critical piece of this puzzle we need to put in place. It's a factor that transcends all of these roles and will ultimately determine your long-term success and fulfillment more than anything else. It's not about your grades, your passion, or even your salary. It's about how you prepare for a world that is changing faster than ever before. So what does that preparation actually look like? It means recognizing a fundamental truth that will define the next 50 years of healthcare. Your clinical knowledge, the stuff you learn in anatomy and physiology, is only half the equation. The other half, the part that will separate the leaders from the followers, the innovators from the obsolete, is your ability to navigate the intersection of health, technology, and humanity. Let's break down the three pillars of the future-proof health science professional. First, and most critically, is data literacy. I'm not saying you need to become a full-blown data scientist, but you absolutely must learn to speak the language of data. In the past, a physical therapist would rely on observation and patient feedback to gauge progress. In the near future, they will be analyzing data streams from wearable sensors that track a patient's gait, range of motion, and adherence to exercises 24/7. They'll use predictive analytics to identify which patients are at the highest risk of re-injury and intervene before it happens. A public health educator won't just hand out pamphlets. They will analyze geographic information system data, social media trends, and wastewater reports to predict and contain a disease outbreak in real time. Artificial intelligence will become your co-pilot. It will scan medical images and flag potential anomalies for a radiologic technologist with a level of accuracy that surpasses the human eye. It will sift through millions of research papers to suggest novel treatment pathways for a patient with a rare genetic disorder. But here's the key. AI is a tool, not a replacement. It can find the needle in the haystack, but it still needs a skilled human to understand the context, to communicate the findings to a terrified patient, and to make the final ethically sound judgment call. If you are scared of data, if you see numbers and algorithms as someone else's job, you will be at a severe disadvantage. The future of healthcare is a data-driven ecosystem, and you either learn to swim in that data, or you risk being swept away by the current. The second pillar is technological fluency. And I mean real fluency, not just knowing how to use Microsoft Word. This is about embracing the tools that are fundamentally rewiring how healthcare is delivered. Telehealth is the most obvious example. It's not a temporary pandemic fix. It's a permanent feature of the landscape. Can you build rapport with a patient through a screen? Can you guide an elderly individual through the process of setting up their device for a remote consultation? Can you use digital tools to effectively demonstrate therapeutic exercises or explain a complex care plan? Beyond telehealth, you need to understand the world of electronic health records, or EHRs. These aren't just digital filing cabinets. They are massive interconnected databases. Knowing how to efficiently navigate them, how to chart effectively, and how to use them for quality improvement is a non-negotiable skill. Then there's the explosion of health tech. Mobile health apps that monitor blood glucose, virtual reality systems used for pain management and exposure therapy, 3D printing for creating custom prosthetics and surgical models. You don't need to be an engineer who can build these things, but you must be the practitioner who can understand their capabilities, evaluate their effectiveness, and integrate them seamlessly into your patient care. Professionals who treat technology as a burden will be left behind by those who see it as a force multiplier for their skills and their impact. The third, and perhaps most important, pillar is radical interdisciplinary collaboration. The siloed model of healthcare is dead. The complex health challenges of our time, from managing chronic disease in an aging population to tackling global pandemics, cannot be solved by one discipline alone. The most effective health science professionals of the future will be what we call T-shaped. The vertical bar of the T represents your deep, specialized knowledge in your chosen field, whether it's nutrition, occupational therapy, or health administration. But the horizontal bar is just as important. It represents your ability to reach across disciplines, to understand the language and perspectives of others, and to collaborate effectively. You will work on teams with software engineers to design more intuitive patient portals. You will collaborate with policy experts and economists to develop sustainable healthcare models for underserved communities. You will partner with urban planners to design cities that promote physical activity and mental well-being. This requires a new kind of intellectual humility. It means admitting you don't have all the answers. It means valuing the expertise of a data analyst or a user experience designer, as much as you value the expertise of a fellow clinician. Your health science degree gives you the entry ticket, your deep expertise. But your ability to build that horizontal bar, to communicate, to empathize, and to synthesize ideas with people from completely different backgrounds, is what will allow you to build something truly revolutionary. So how do you start building these skills right now as a student? You have to be intentional. It won't happen by just following the standard curriculum. First, get strategic with your electives. Instead of taking another biology class, take an introduction to Python programming. Sign up for a course in data visualization, bioethics, or even marketing. Understanding how to communicate a health message effectively is a superpower. Second, rethink your extracurriculars. Don't just volunteer at a hospital to check a box. Find a health tech startup and offer to help with user testing. Join a university-sponsored hackathon, and team up with computer science students to build an app that solves a real-world health problem. Start a podcast where you interview researchers and practice breaking down complex scientific topics for a general audience. These experiences are worth more than a perfect GPA because they teach you how to apply your knowledge in the messy, unpredictable real world. And third, diversify your mentors. Find a clinical mentor in your field, of course, but also find a mentor who is a hospital administrator, a public health official, or a venture capitalist who invests in healthcare companies. Ask them what problems they're trying to solve. Ask them what skills they're looking for when they hire. Their perspective will be invaluable and will open your eyes to career paths you never even knew existed. This brings us back to the central question we've been exploring. Is a health science major right for you? After everything we've covered, from the specific careers to the future of the industry, the answer should be clearer. This major is not just for people who are good at science and want to help people. That's the baseline. This major is for the problem solvers, the curious minds who are not intimidated by change but are energized by it. It's for the communicators who can bridge the gap between complex data and human emotion. It's for the collaborators who understand that the future of health won't be built by lone geniuses, but by diverse, integrated teams. It's for the lifelong learners who are committed to constantly updating their skills, in a world where today's cutting-edge technology is tomorrow's relic. Choosing this path is about more than securing a stable, respectable job. It's about choosing to stand at the epicenter of human progress. The challenges are immense, but the opportunity for impact is almost limitless. You won't just be treating one patient's symptoms. You'll have the chance to design systems that prevent disease for entire populations. You won't just be helping someone recover from an injury. You'll be leveraging technology to restore human potential in ways we can barely imagine today. A health science degree isn't a destination. It's a launchpad. It's the foundation upon which you can build a career that is not only financially rewarding, but deeply, profoundly meaningful. So, as you stand at this crossroads deciding on your future, the question to ask yourself is no longer just, am I passionate about health? The real question is, am I ready to build its future? Are you ready to embrace the data, master the technology, and collaborate across boundaries to solve the most important challenges of our time? Because the world isn't just waiting for more healthcare workers. It's waiting for healthcare architects. It's waiting for you.